I'm Annaeleise Dolph. I'm excited to be here today. I'm the director of the Alcohol and Drug Policy Commission. I think I'm on week maybe technically 10, although really about like 5 or 6. And I still don't have badge access to my office, so we're working on that. I was formerly the governor's behavioral health initiative director, and before that I worked for the governor over in the speaker's office. I will start by being completely frank with you all that I am not a subject matter expert. I'm a lawyer by trade and got into policy at some point during my career, probably 15 years ago. Let's see, how do I advance this? I'm going to start today. I'm going to talk a little bit about, if I can figure out these slides, I'm going to talk a little bit about what exactly the Alcohol and Drug Policy Commission is, because I think it's very important for folks who are on the ground providing services to understand this like structure that we have put over you that is supposed to be moving forward improvements in the system. But I really want to start by talking about Governor Kotek's vision. And I share this vision for 2 reasons. First, this is why Ebony, I don't know where she went, why Ebony and I are actually here. You probably would not have Ebony and I in these positions if it weren't for Governor Kotek. She is deeply committed to behavioral health and is also incredibly pragmatic and approaches things with a great sense of urgency. So when I tell you that Ebony and I have both been told very personally by the governor that it's time to Friday filter, get shit done, that is exactly what we're here to do. So when I say to you or Ebony says to you, please hold us accountable, tell us about what's not working in the system and what is working, we actually mean that. I also share this because we are at a moment in Oregon where I believe that we have an incredible opportunity. We have a leader that is incredibly committed to the work that you all do. The governor's three legs of the stool, as I like to call them, are housing and homelessness, behavioral health, and early learning and youth. And so those 3 combined just sit right in the middle of what you all do. So I want to start there with the governor's vision, which really truly is that people will be able to get the services that they need, when they need them, wherever they need them, and that they are culturally and linguistically appropriate services. So now I want to shift a little bit to what exactly is the Alcohol and Drug Policy Commission. Those of you who have heard it before probably have your opinions. Many of you have shared them with me. So the Alcohol and Drug Policy Commission actually has a pretty weedy job. My job is not to micromanage what the Oregon Health Authority does. One of my jobs is to make sure we're breaking down silos in the same way Ebony's doing that within OHA. It's my job to do that across state government. But the ADPC, as we call it, is primarily charged with improving the effectiveness and efficiency of state and local alcohol and drug abuse prevention and treatment services. And this specifically includes a plan with some pretty weedy elements that I'm going to read to you guys. And I'm doing that because in order to do what I'm supposed to do in this plan, I need to know how it's going for you all. And quite frankly, it's something that we haven't done a great job of in Oregon, I think, getting a little weedy like this. So I'm supposed to come up with a plan every 2 years with recommendations regarding the capacity, the type, and the utilization of programs. Wouldn't that be nice if we had like a dashboard that talked about like how your programs are utilized and how many more of those services you need? Methods to assess the effectiveness and performance of programs, the best use of existing programs, budget policy priorities for participating state agencies, standards for licensing programs. I find that providers really like that one. Minimum standards for contracting for, providing, and coordinating alcohol and drug abuse prevention and treatment services. And that actually goes across federal, private, and state-funded services. And the most effective and efficient use of participating state agency resources to support programs. So I share that, again, because it's really, really weedy. But I think that it's time to go there. And I think as a state, we have support from leadership to make this system better. I think people are listening and they really want to hear what you have to say. So in 2020, leading up to 2020, I guess I should say, like 2018, 2019, the Alcohol Drug Policy Commission came up with a 5-year strategic plan. If you haven't seen it, feel free to come up to me. I should have started by saying this. My chair of the commission, Tony Vesna, is in the back. Yay, Tony. If any of you want to have questions and are interested in the ADPC, please talk to Tony or I today. The strategic plan is a little, it's large. It's got a lot in it. And it was designed before COVID. It was before the pandemic. It was before we started seeing, the fentanyl deaths, overdose deaths that we have seen. So we have some work to do. But it basically has 4 high-level outcomes and 4 strategic goals to get there. So the outcomes are decreased prevalence of substance use disorders, decrease of Oregonians who die, obviously, reducing health disparities, and reducing the economic burden of substance use in Oregon. I would venture to say that there's probably no one in this room who would disagree with me when I say we can't get there unless we address youth. So while you might not see youth prevalent, like in the words on the paper, we can't get there unless we go through the youth. And so there's 4 kind of strategic goals to get there, and then there's this whole list of outcomes underneath them and all these metrics that I'm sorting through with our staff. But really, to get there as a state in 2020, what we said was to get to those outcomes, we need a true statewide system. And so again, this goes back to breaking down the silos between state governments, figuring out what the left hand is doing and the right hand is doing. I'll give you an example of one of the things I'm sorting through. Naloxone, right? OHA has this great Save Lives Oregon program that's prioritized getting naloxone out to schools to make sure they have naloxone kits. The Department of Corrections is offering naloxone to every prisoner who leaves. Some jails are doing it. Clackamas County has vending machines outside the jail. Yeah, that's pretty cool. That's federally funded. That's not state funded. We have opioid settlement money coming in. We have nonprofits coming in who are offering to pay for naloxone for school districts. The story goes on and on and on. OHA also is covering naloxone, in case you're wondering. We have so many good things happening in Oregon. We have to get our arms around it, though. We have to get our arms around it so that those of you who are on the ground know, oh, okay, this person has this. I don't have to do it. You are all too busy and for you to be duplicating each other's work. So we have to get our arms around that. Prevention. This one has been a little funny. I'll acknowledge I think some people in the room may have been at our prevention workshop that we had last week. The Alcohol and Drug Policy Commission hosted a half-day prevention workshop. Prevention, capital P prevention. So as I understand it, we've got prevention, treatment, recovery, and harm reduction. I think sometimes when we use the word prevention in terms of harm reduction, I think we get it confused with primary prevention. I think you all understand that, but that's one of the things that I need to break down for us. So capital P prevention, though, which is part of the work that you all do. Access to treatment. I think we all know that this is just huge, and we're in a crisis right now. And OHA is really digging in on this area, and I think it's a great opportunity for all of us, particularly in the youth space, to call on OHA in particular. They're finishing a behavioral health facility inventory right now for adults. I think we all need to come together and ask OHA to jump right into a youth inventory so that we can assess our need and ask the legislature for more funding to fill that need. And then finally, recovery supports is the 4th tenet of the ADPC strategic plan in terms of goals. So I think when you see this, I'm sharing this with you so that you can understand where we're at. It's very high level, right? And we need to prioritize. And so that's what the commission is going to be doing over the next couple of months, is really saying, okay, what are our top 3 priorities and how do we get there? And I think we need that kind of focus. Okay, we also have, in addition to those very high-level goals, the governor has very clear direction on where we need to prioritize in terms of her vision. Youth prevention strategies is clearly one of those. Treatment capacity, a harm reduction strategy to reduce deaths, and public education on fentanyl and emerging threat of xylazine. And I'll just take a moment to talk about this one as well because I have time and I love to talk about xylazine. I was speaking to a partner in law enforcement the other day, and I put this out there because I want you all to disagree with me if I have this wrong. A partner in law enforcement that said, I don't know why it's important to let people know that xylazine is coming into our drug supply. And I said, well, there's obviously, the wounds and the wound care and, people losing their limbs. But there's also the fact that it's my understanding, I'm not a subject matter expert, but when people have xylazine in their system, they pass out for a really long time. And they get abused. So I think it's really important for people to understand that that's coming in the drug supply. And then the other piece, as I understand it, is it really complicates withdrawal. And so maybe it's not the xylazine that's killing people, maybe it's the fentanyl, but it's really going to complicate things. And so I think it's really important for our treatment professionals to understand that. So you all tell me if you think I'm wrong about that, but I think that's why it is important for folks to understand what is in the drug supply, especially kids. Like, it's just one of the things that at our prevention workshop we had, the youth, really their message, it was a partnership with the System of Care Advisory Council. I think we didn't quite tie the connection together there well enough between system of care and substance use disorder and prevention. So I really appreciate Ebony calling out system of care. But the youth said, don't sugarcoat it for us, right? Like, just telling us, don't do drugs, it doesn't work. Like, these kids are smart. They want to know what's in the drug supply. They want to know what it does to their brains. I'm a mom. I have 2 I have a young adult, I guess, a college student, and a high schooler and a middle schooler. So these are kinds of things that we talk about in our house all the time. Like, these kids aren't dumb. They have the internet. They know more about what is in different things than I do. So let's not talk down to them. And that's important to the governor, that we have an effective consumer engagement campaign. So bringing this back around to the ADPC and our next steps, I get asked a lot, what is your vision? Well, golly gee, I think I have the same vision that everyone else in Oregon does, right? That we have less lives that are ruined by addiction. But in terms of the Alcohol and Drug Policy Commission and our role and our next steps over the next year, we're really working to first build a foundation. We have 5 or 6, I forget the exact number, I think it's 5 new members coming onto the commission this fall. We are, I hope, adding some new subcommittees. The System of Care Advisory Council Director, Anna Williams, and I are asking our respective councils and commissions to form a joint youth committee that can really focus on what are the immediate outcomes that we need to be focusing on for youth in Oregon when it comes to substance use disorder, and then building a longer-term plan. Really figuring out what are our data and metrics. So I came into this job with one of the things I have to do is report out by next July how we're doing on the strategic plan, how we're doing as a state. We have, I'm sure you all know, various dashboards kind of around. We don't have one dashboard that just says how we're doing as a state. So we need to figure out what are the data that matter? What are the metrics that matter? Are we measuring the right things to get to the outcomes we want to get to? Bridging the divide. I've talked about this a couple times. Really starting to break down some of those silos. In the law, there's a number of participating state agencies that the ADPC is supposed to be working with, bringing together on a quarterly basis to start sharing. So we get some of that, well, if you're doing this, then I'm doing this. I'm sure a lot of you out here receive money from not just OHA, but from other state agencies. I know in the housing and behavioral health space, I've heard a lot of feedback from providers, some providers telling me that they have 40 different state contracts. None of them align. So I think we can start to make some progress there so that you all can do your work. And finally, closing the gap. We have a mounting amount of data and information that tells us as a state where our gaps are. OHSU did a gaps analysis last year. Some of you may be familiar with it. Garnered a lot of headlines. We have less than 50% of the services that we need to meet the need. We can do a lot more work to tease out what that gap is for youth, but we do have some and continuing information coming. Now it's, what do we do with it? It's fine to study and say we don't have enough services. Now we have to take it to the next level and figure out how to meet that need. So with that, I think 20 minutes was my, if there's extra time, I can take questions, but I think it was 20 minutes there. So I really appreciate the time. I appreciate all of you and everything that you're doing. If you are interested at all in the ADPC, again, please feel to grab me or Tony Vesna. We have a treatment subcommittee as well as prevention and recovery. Happy Recovery Month. Give that little shout out there. Yay! Not that I have any preference for recovery. I love prevention, treatment, recovery, and harm reduction all equally. And hopefully we will also form a harm reduction committee as the commission kind of gets going again. So that is my kind of dry, high-level overview, a little early in the morning, but I'll turn you over to folks for some more substantive knowledge today, and I really appreciate the time. Thank you.